This conference will now be recorded.
Thank you for your patience. My name is Jan Intrican, and I'm with the Mississippi Public Health Institute, and we are going to get started. If you have a question, please, if you're on the webinar, if you will send it through the chat function, and we will answer questions at the end. And then those of you who are on the phone only, when we finish with those questions, we'll open it up for you as well. And I know I've said this about 7 times already, but I will reinforce, please, one more time that if you are on any volume, needs to be on mute because we pick it all up as background noise. Thank you so much.
Good afternoon, everyone. This is Joy, the VAWA Administrator. I want to thank each one of you for being here and for attending. Basically, Gloria Salters, most of you have worked with her over the past few months with the annual progress report. She's going to be doing the majority of the presentation. However, I just wanted to give you a couple of pointers and a little update. One of the things we need you to continue to do is utilizing your quarterly reports and sending those in. And then also, our report to Muskie is due by March the 31st, and that seems like a long way away. But I want you to go ahead and write down that we'll need your completed reports to our office by February the 15th of next year. And that will be this report that Gloria is going over. So once again, like Jan said, if you have any questions, if you'll either type them in the chat or save them for the end, and then we'll review those things. Thank you again.
Good afternoon, everyone. Let me begin by saying, for those of you who were sub-grantees last year, I want to thank you for your report and for the hard work that you did on your report last year. With some, I had to work a little bit more than with others, but all in all, the reports came in and the information was very good and very well presented. I am happy to say that of all of the reports that we submitted, and it was probably more than 80, we only had 2 that Muskie had questions on, and they were very minor. So hopefully this year will be the same way. The 2019 report will cover January the 1st, 2019 through December the 31st, 2019. And this is why we're trying to get started early. Number one, to ensure that you understand what data is required on the report, and also to point out some new items that are being required to be reported. I did get quite a few questions in regard to some of the sections on the report in regards to how to report certain things such as full-time employees, also the difference between the different function areas. So hopefully after today, some of those questions will be answered and you will be ready to move forward with collecting your data. On another note, with this being halfway through the year, I want to point out that you will be operating under 2 different sub-grantee agreements, which I'm sure many of you are aware, so we will talk about that a little bit also. So we'll start, and I'm not going to go through the entire report because I do not want to insult anybody's intelligence as far as being able to read through the report. However, I will highlight some things. And I think the report that Joy submitted to each one of you, some items were highlighted. I went through the report and just tried to highlight some things that were questioned last year to make sure that you pay close attention to those items. So let's begin by indicating that as far as the report is concerned, the report is broken out into different sections. There is a section A, a section B, a section C, D, E, and F. And all of those sections are relative to parts of the requirements as far as the data to be collected. In regards to the sections B, F, A1, and A3 should be completed by everyone. And those areas are the purpose areas, the narrative, general information, and the community coordinated response. So those sections should be completed by everyone. All the other sections will be dependent on what your subgrantee will cover. And all of those things should be relevant to, number one, your scope of services and your budget. So whatever data you submit, it should be able to be tied back to your scope of services and your budget. Over in section A, if you have your report in front of you, it's pretty much just the general information. Under number 4, last year I noticed that there were all different types of numbers that were included as far as the subgrant number. So this year, for the period of January the 1st through June the 30th, you will have in that section STOP, S-T-O-P, -2017 your unique code. And you will find that on your workbook. You should be able to find that on your workbook, and that is the subgrant number that you will include for the period of January the 1st through June 30th. Because once again, you're operating on 2 different subgrantee agreements during this reporting period. The next number for July the 1st through December 31st, there's going to be a Pacific SGR number, and that also will be included on your workbook and your subgrantee agreement. So those 2 numbers are what you should show on your report. On number 5, your description should be relevant to your organization. So when you're looking at these descriptions, just make sure that you pick the one that's closest to your organization. All of those faith-based organizations, make sure you notate that you are faith-based organization. And also, if your organization is culturally specific organization, then also indicate that. The point of contact, this should be the person who, if there are questions regarding your report, this is the person who we should contact. So whoever that person is, this is who you should include in that area. I think everything else is pretty much self-explanatory. Under number 8, it asks what percentage of your services were applied to each of the categories as far as sexual assault, domestic violence, or stalking. And whatever percentage you put there, it should total to 100. And whenever there is a total, you do not have to total those items. It will automatically total for you. Okay. Moving on to staff information, and this was an area that we had some subgrantees who had difficulty in determining their full-time equivalent. So under this particular category, we're only referring to those individuals that are paid out of your STOP grant, subgrant. It also includes your consultants, if you're paying for consultants, and it also includes contractors. So if you have contractors, consultants, full-time employees, part-time employees, you need to evaluate what that FTE relates to. In addition to that, if you have volunteers or you have interns that an employee under the STOP grant is supervising, you should also include them. Okay, I'll say that again. If there are some volunteers or interns that an individual who is paid under the STOP grant is supervising, you should also include them. Okay. Now, under the purpose area, I know it's a lot of areas and it's a lot of reading, but to ensure that every area that is being addressed under the STOP program is selected, please read these categories, and you can select as many categories that pertain to your STOP subgrantee agreement. So please read through these and make sure that you select all those that apply. Okay. Moving on to the function area. Under this area, there are 7 categories: training, education, CCR, policies and legislation, products, data collection and communication, specialized units, and system improvement. So you pretty much know what you are doing under your subgrantee agreement. Once again, that should be relevant to your scope of services and your budget. So on these particular items, if you know what function area you are performing your scope of services in, then you can go to that area and complete that particular portion, such as if your subgrantee agreement is specific for training, then you know that you probably will only have to fill out the training section and the CCR section, because once again, the CCR section, every subgrantee is required to fill out. But in every category, you cannot just skip over the category. You have to indicate yes or no. If it's no, fine, skip on to the next one. If the next one is no, skip on to the next one. But please do not leave it blank. Select one of the two, yes or no. And then these particular function areas, once again, I highlighted some things that we hope that you will pay close attention to. For instance, under training, training refers to only training that is provided by an individual that's funded under your STOP subgrantee agreement. Once again, your training is only relevant to those individuals that are trained by an individual staff person that's providing the training. So if your person who is funded under STOP is training individuals that work for your agency, then you should not include that. Okay. Under education, read those items very closely and select the individual events, the individual topics that pertain to the services that you provided. And I went through this particular area also to highlight some things that need to be paid close attention to. Okay. Under the coordinated community response, same situation. There are some things that are highlighted that you should pay close attention to. Make sure that you select every agency that you are meeting with, that you're engaging with, that you're making referrals to. Make sure you identify those agencies under this category, and as you can see, there is a section for other. So if there's one that's not listed, please list it under other and indicate how frequently you are meeting with these individuals or that you are providing technical assistance or making referrals. But please be cognizant of all of the entities that you are providing these services or referring these services to individuals. Every section, I wanted to point this out, every section has a narrative. And we really implore you to use this section to write a narrative on what it is that you're doing in your agency. How was it impactful? How were the services accepted? And what were some of the outcomes? We just want to stress that it's so important to use the narrative box to identify, how these funds are actually making an impact on the communities that you're serving, on the victims that you're providing services to, on law enforcement, on whatever entity there is that actually benefit from the services that you're providing. We ask that you use the narrative category to expand on those services, because a lot of times a check box does not really show the complete picture of what it is that you're doing in the community. Okay. And I think all the other areas for the product, a lot of you under your subgrantee agreement, you have where you're doing brochures, you're doing PSAs, you're doing manuals. Some of you who have training subgrantee agreements, you're developing curricula. So identify those items. If you develop a new one or if you're revising an old one, it needs to be identified in this section under products. Any brochure that you're developing or revising, it needs to be shown here. Because once again, in your budget, many of you have asked for funds to be able to do these things. So it should correlate back to that budget that these items were done. And data collection, I can't recall anyone except for I think one of the courts were going to do something with data collection, but if you're doing anything with data collection, please expound upon it in this area as far as data collection and communication systems. Specialized units. I had a few questions regarding it, and this basically pertains to those subgrantees who maybe established a new domestic violence unit, per se. Then you actually developed a specialized unit under the STOP program. So those things need to be identified. If there was a special position, maybe there was not a DA or prosecutor who was focusing on domestic violence, but it was established under the STOP program, then that needs to be identified. So just make sure that these items are really thought about and clearly indicated on your report. If there was anything done with system improvements, it should be identified under C8 for system improvement. And this is specifically for staff engaged in system improvement. Not just any staff, but a staff person that's paid under the STOP program. So So if that person is engaged with system improvement, then that should be identified under section C8. Okay, now I think we're moving to the areas that there were a lot of questions. Section D and section E, there were a lot of questions pertaining to how services are represented. If you have a staff person that is providing victim services, all of that information should be provided under section D. Now, there were a lot of instances where there was a victim advocate. The victim advocate was actually a law enforcement officer. So individuals try to record their information under the law enforcement section E1. But while they might be a law enforcement officer, their role under the STOP program is victim advocate. So what they should be doing and what services they should be providing is victim services. So their data should be under victim services. Now, if there was some point in time that they maybe went out on a domestic violence call or something to that effect, and that time was charged under the STOP program, then yes, that was a law enforcement activity. So it should be recorded under law enforcement. But as far as the STOP subgrantee agreement, that person is in the role of a victim advocate. So just be very, very careful when you're separating what your title is, which it might be officer whoever, but officer whoever is actually the victim advocate and should be providing victim services. There is one new category under victim services that I wanted to point out, and it's under question 30. And under question 30, it asks for all new victims. All new victims. So when you answer number 29, where you identifying all victims or survivors served under section 30, number 30, you will report only the new victims. And when we say new victims, those victims that were new as of January the 1st, 2019 through December the 31st, 2019. Let me say that again. These are new victims that you are serving. So pay close attention to number 30. It's not asking for all victims. It's only asking for the new victims. Now, if you're new and this is your first subgrantee agreement, then those numbers might be the same. And if there are some programs who serve victims during a period of time from the last reporting period, and all of those victims either were no longer in your program, then your numbers would be the same. But that's probably highly unlikely that all of those that were served last year are no longer being served during this period of time. So you will have to separate out those. I would say those are your continuing victims and survivors from your new victims and survivors. And number 30 is the only one. I think that's the only new question that is being required that you answer. So that was really one of the reasons why we wanted to start early because many of you are probably not collecting data to that effect where you are identifying the new victims or survivors. So it might take a little time for you to be able to implement that into your protocol as far as identifying those victims. Okay. Under the demographics, make sure that's number 34. I wanted to point out to make sure that you identify the race of your victims, also your gender and the age. And you will notice when you're doing your report that there are going to be certain times when the report would tell you that the numbers cannot be over a certain number, or the number should be at least this number. So when you're doing your report, make sure you're reading that section, and it will let you know that, well, if I have only 20, but I should have 24, then you know to go and look to see where you're missing that data. It pretty much leads you to where you need to go as far as the report is concerned. It will tell you, well, the number can't be more than this. The number must equal this. So just pay close attention to that and make sure that everything is representative of what the instruction says. And once again, do not total anything. The system will automatically total your numbers for you. So anytime you see total, you shouldn't do anything. It should automatically populate. Okay. I want to say that's all under the victim services. I think everything else is pretty self-explanatory. Just once again, just pay close attention to your numbers and what you are recording. And the system will do a validation. So if your numbers are not correct, you will not be able to submit your report or close out your report. Okay. Let's go to the shelter services. Those of you who are providing shelter services, those are services that when you're counting those services, it's for every individual that you provided the services to. So if there is a mother who enters the emergency shelter and she has 3 kids, then that would be 4 people that you're serving, and you just multiply that by the number of nights that you serve them to come up with the total. So count everyone that you're providing the services to. Likewise, with the hotline, make sure that you're reporting on your hotline whether or not you're providing information, referrals, whatever that might be. If it's coming through your hotline, you should be counting those calls. So pay attention to those. Protection orders, you should be reporting on your temporary and or your final protection orders. These are protection orders that are requested and those that are granted. So make sure you include both. And there's a line for each one. Okay. Legal services, pretty self-explanatory on that. Let's see. With your legal outcomes, let's go to that. I wanted to highlight that what you should be reporting are those cases that have been closed or issues resolved. So there should not be anything that's pending in this category. It's just only on those cases that are closed or issues have been resolved. Okay. And once again, use this narrative area to discuss or expand upon the numbers that you have presented, because a lot of times the numbers do not represent everything that you're doing. So, please use this area to state your case that, we are providing the services. This was the impact. This is how effective it was. Just whatever you feel that your numbers are not representing, do it in the narrative piece. That's what it's there for. Okay. Now, Section E. And Section E is divided into, once again, law enforcement, prosecution, court, probation and parole, and batterer intervention program. Under the law enforcement, this is only law enforcement activities that are funded under the STOP program. It also includes those who are required to pay a match. I failed to mention this, but if you're paying a match, you're required to put up a match, and your match is being provided by a law enforcement salary, then you should also include those activities. Okay. So, and likewise, if there's a prosecutor that's being used as match under your STOP program, then those activities that are done by that particular individual should also be included under this report. Under law enforcement, there are several activities that are outlined, so please read through each one of them and make your data known in regards to that, as far as calls for assistance, cases investigated. It pretty much outlines just about everything that a law enforcement officer would probably be doing. So please read through all of them and identify by the data that you're collecting, the categories in which services were provided. If you were involved with forensic medical evidence, please identify that. Arrest, please identify that. Enforcement of warrants, identify that. Protection orders. You just identify all of those activities that you are doing under the STOP program. Under the different categories. Same thing on the prosecution. There's a section for just about everything that I guess would be involved in prosecution. Please read through all of them. The number of cases received, the number of cases accepted, the number of cases declined, transferred to a higher court, referred for federal prosecution. These are some things that that are needed. These are some numbers that really can show a picture of what's going on in the communities that are being served. So just make sure you read through each one of them. Okay. On the court. Under courts, you basically identify the disposition of the cases that come to the court. So make sure that your numbers are representative of what's being done through the STOP program in regards to felony stalking, misdemeanor domestic violence, felony sexual assault, misdemeanor. Record all of your numbers, please. Okay. Once again, I just can't tell you enough. Please use the narrative area, please. probation and parole, I didn't find very many people that were involved with these activities, nor the batterer intervention program. So, but please, once again, if you are identify that information through the numbers that you record in your report. Okay, the last section is the narrative. And let me point out first that, and I don't know why they did it this way, but on the report, it actually asks the questions first, questions 69 and 70, 71 and 72. They ask the questions first, and then it provides you with a narrative box to provide your information. And I wanted to point out, especially on question 69, it says it wants you to identify areas that still has a need. And unfortunately, many people left it blank. And I know there are needs out there. There should have been needs that your multidisciplinary team has identified. I just know that there are needs out there that are not being identified. And, you know a lot of people feel that these reports are being done and they don't mean anything, but they really do. These reports impact the funding that continues, but if you are identifying that there are no needs out there, that's not very good. There are over 80 plus sub-grantees out there, and you only have 5 that says that there's a need that, in some people's opinion, that might say, well, this funding is not needed because there are no needs out there that are not being met. So that's, when you're completing this report, the narrative section is very, very important. And we must keep in mind that this is a research institute that's actually gathering these reports, reading through these reports, combining all of the information, developing a report that goes to, it goes to Congress. So while we might not think people are reading them, there are some who are. And it helps when the narratives are completed. If you would just indicate, it does not mean anything negative against you, because as a sub-grantee, you can't provide all of the needs. So it's nothing negative against you, but there are needs out there that are not being addressed. And if there are some that you are aware of in your community, please expand upon those in the narrative. Same thing with question 70, that asks you, if you didn't have these funds, what is it that you could not have done? If these funds were no longer available, how would that actually impact you and your community? Go at it at another angle. The question reads, what has stopped program funding allowed you to do that you could not do prior to receiving the funding? But actually, you can turn it around and say, if I didn't have these funds, what impact would it have on my community? What impact would it have on the victims? And I know that you all can identify some of that. So please include that in your narrative. Question 71, I think that's a new one, on the Crystal Justin Domestic Violence Protocol Program.
Everybody got that.
Yeah. So
they don't have to.
So according to Joy, no one is funded under STOP that's actually addressing that. So I don't think you all have to worry about that. And then it asks you in question 72, which I think this is the one that you probably should have had to need additional space, because what it asks is for you to provide additional information that you would like for them to know about your program. Now, this is a time for you to really, really talk about what it is that your program is doing in your community, why you're so important to your community. This is, I guess in a sense, this is a time for you to brag about what you're doing, some of the successes that you've had, some of the families that you've served, or some of the victims that you've served, and the outcome, positive or negative. And one of those negative outcomes could possibly be because there were no services available in your community. So those are the type of things that you want to provide in question 72, and expound upon those items. And then it asks you about the data that you submitted. Is there anything that you would like for them to know? If you look at your numbers and you say, oh, well, to somebody, to the naked eye, this might not look good, or it might not look positive, this is where you want to expand upon it. You want to expand upon the fact that, there were some sub-grantees for a whole year that did not serve more than 25 people, or didn't serve more than 20 people. While that's good, because that means that, there were not very many victims, but to someone who's supporting this program, their question might be, well, why were they funded when they're serving so few people? You might want to expand on that as far as why your numbers were looking like that. So this is a prime opportunity for you to really discuss your data and discuss why some things look the way that they do. And also, it can be a justification for low numbers or high numbers or whatever the case may be. Okay. And like I said, the questions are asked first, and then they provide the space for you to put the narrative. So please use this blue area in each one of them to provide your response. And that brings us to the end of the report. And the reason why we didn't actually go over the SAS report, because they're basically the same report. So those sub-grantees that also have a SAS grant, it's basically going to be the same. Some of the questions are a little different, but it's basically the same. Okay. I guess we're going to start taking questions.
Okay. The first one is in reference to training. Our agency hosts an annual DB workshop that provides training to our officers as well as from other area agencies. If a speaker is from other area agencies, if a speaker is used, am I not to list it under training?
Is the speaker being paid under the STOP? If the speaker is being paid under the STOP program, then yes. Also, if it's do not include it, well, that's the question you asked. So no, do not include it if it's any of your staff, but if it's other law enforcement and other agencies, then yes. If you're sponsoring the training.
If I'm doing case management for shelter clients, do I add that under shelter services on my report?
Let's see. I'm doing case management. Shelter services is actually under victim services, so it would be under that category. Yes. If you look at Let's go back to victim services. If you look under victim services, that's one of the categories for victim services. So you were actually listed under that because all of that is still victim services. All of that will still fall under Section D, victim services.
For Section E1, I spoke to someone last year, and my understanding is that I am only to report numbers that I personally accumulate, not the entire department. Correct?
That is correct. Only the services that are provided through a stop-funded staff member.
Is the VAWA SASP due for the same reporting period, same due date? 2/15 is a Saturday.
Yes. It will be due at the same time.
So with 2/15 being on a Saturday, let's make it 2/14 to be safe. That's from Joy, yeah. As the VAWA administrator, I'm going to put that we're going to have it due the February the 14th.
Do we have any questions from anyone on the phone? Okay, we're going to just have a few more minutes. Joy has some closing comments to make, and then we'll be finished.
Okay, thank you guys for showing up and asking questions and things. A couple of things that I wanted to go over is one of the things that Gloria and I will be checking for, and she mentioned this throughout the presentation, but we're going to be checking to make sure that your data correlates with your agreement and your activity logs. So what you're saying that you're doing, we need to see that reflected in these reports, okay? So if you have activity logs that say that you're doing certain things and it doesn't show up on your annual report, then we're going to have to kind of figure out what's going on there and why things are not being reported. I can say from a personal/professional experience, you guys have a copy of this report. Figure out what works best for you. I worked as a sub-grantee, and it worked better for me doing this quarterly because then I didn't have to figure out all my numbers at the end of the year. You have a copy of this now. We're over halfway through the year, so it's going to make it a little more difficult, but this can kind of prepare you maybe for next year. Figure out what's best for you and do your reporting that way. Then you can just combine your numbers at the end of the year if that makes it better. I can say that on those narratives that Gloria kept talking about that were so important, I can say when I was a sub-grantee, that was the thing I hated the most to do. But if you're going throughout the year, think about things. If you have an aha moment or a wow moment, one of those moments like, wow, look what we did, our agency did awesome on this, be able to document that. If you're sitting there around having a case management team meeting and someone says, I wish we could have helped this person with this or this or this, but we couldn't because, that can go in your narrative so that we'll understand what you can accomplish, what you can't accomplish, why you can't accomplish it, and that might be a way that we need to start some trainings and provide some different technical assistance to different people. So make sure that, as you think about it, just write it down. So a few ideas. Again, we thank you guys for attending. We thank you for being here. I think each one of you probably have Gloria's email address. If you need it at any time and don't have it, if you'll let me know, I'll send it to you. I know that each one of you have my email address because we have all been in correspondence. So thank you again for what you do. We appreciate that very much. We want you to know that we're here for you, and if you guys have any questions, just let us know.
When will the recorded session be available? Hopefully by early of next week.
I should get an email letting me know when it's available, and I'll let you guys know.
I think there was also a question in regards to an investigator.
Yes.
If we have a DV investigator, would he also be considered law enforcement as it relates to Section E1? And of course, the answer to that is yes.
We'll be given info about the monthly reports during this webinar.
No, that was a separate webinar, and if you will contact my office, if you'll send me an email, I'll send you the links for that.
Others are all on.
Okay.
Yeah. Any of the previous webinars that we have done are available online. If you'll send Joy an email, and she can send you the link to that.
Tell me what you need, and then I'll send you the link.
I want to go back to the question in regards to the investigator. Please pay close attention to what your role is and not what your title is. As I said before, you may be a law enforcement officer, but if you're in the role of the victim advocate, you're not a law enforcement officer. Now, if you're also providing law enforcement activities under the STOP grant, for instance, if you're also being paid to be on call or to, carry out arrests or go on calls or whatever, then that should be recorded in your monthly activity report. And likewise, it should be reported on your annual report. So in that case, you would have information under E1, law enforcement, and you would have information under victim services. It's about what role are you in, not your title.
Jennifer, we're looking at your question about what the investigator does. That investigator would definitely fall under the law enforcement role.
Yeah.
All right, I think that does it. There are no more questions. So we thank you guys again, and we'll let you know as soon as this is available for review online. Thank you.
All right, great.